wanted to give a bit of background and context in for Ireland and our kind of the basis of which we're starting from in this. So early learning and childcare, as we've discussed, is currently entirely privately delivered in this country, with 75% operating on a private for-profit basis and 25% on a private community not-for-profit basis. So it is entirely private, part of it for-profit, part of it not-for-profit, but that's certainly one of the key takeaways that I have from Eva's presentation is the distinguishing within that private for-profit part of the sector, that we don't lump that all together as a single, that there are kind of different strands within that, and that present kind of different risks and opportunities, I suppose. We estimate that around 70% of services costs are funded through current schemes of the department, through core funding, National Childcare Scheme, the Early Childhood Care and Education scheme or programme, with the remainder coming from parents' fees. But there is substantial variations in that, in line with the type of service delivery and the context within services are operating. There has been, again, as Eva spoke to and as she was instrumental in kind of framing, there has been increased investment and incremental introduction of public management. And by that I mean the type of regulation that Eva kind of pointed to in other countries and in this country in relation to fees, in relation to wages, and in relation to kind of operational transparency. So there have since so following on from the publication of Partnership for the Public Good in 2021, there has been fairly substantial developments in that area. The other point to note, and this kind of tees up some of the rest of the discussion, is that a significant proportion of services currently operate in publicly funded buildings. So that includes some of that Equal Opportunities Childcare Programme, National Childcare Investment Programme, those large funding schemes going back a number of years, as well as more recent capital funded infrastructure. 22% of services operate in schools, and local authorities are landlords to many services, in some counties more than others. But I think that's an important context to remember as well. And I suppose the reason I'm setting out some of this is to kind of go back to the key question when we're talking about a public model. What is it that we mean by a public model? Because there are certain features in terms of the funding, in terms of the kind of regulatory and contractual infrastructure that is around services, in terms of the building ownership to a certain extent. We have some features in some of the areas. So anyway, I'd be interested kind of in the discussion following on to kind of tease out some of what we actually mean when we're talking about a public model. And I suppose one key point to note, I suppose this is somewhere in a way in which there isn't an element of a public model, maybe depending on how you characterise that, is that most operational issues are determined at individual service level. So that includes the number and type of places, the hours of operation and staffing. So they're kind of key elements that, well, as I said, depending on how you characterise it, you might expect to see in a public model. So some of the key policy issues, and again, this is very much coloured from, the perspective that my kind of remit in the Forward Planning and Delivery Unit, is that access to places is now a bigger issue for parents than affordability. So kind of historically, we had, and indeed we obviously continue to have significant affordability issues, but from parents' perspective, that has reduced relative to the issue of places. And those two things are connected, and Eva talked about that in the English context as well, as there was greater levels of subsidy for places that engenders greater levels of demand, which puts pressure on places, obviously. And as I said, there's been substantial progress on affordability between NCS and core funding fee management, although in many instances a very long way to go on that. In particular, kind of drilling down into the challenges in relation to the supply issues. In particular, there is insufficient full-day places for pre-HA age children, so that's not quite equivalent with under threes, but almost. And also insufficiency of places for children who are HA age, but whose parents would wish them to stay on for full day provision. So 44% of children in both pre-HA and HA age would prefer for centre-based care to be their main care arrangement during the week, but actually only 25% of parents are accessing this type of care. So that points to a very substantial kind of gap there, obviously. Supply challenges, again, speaking to the theme, supply challenges are much greater in areas of disadvantage and rural areas. And staffing is obviously a key constraint on places. And within all of this, then we have the first 5 targets to deliver 60,000 under 3 places, and that's to enable the fulfilment of the Barcelona target, which is participation of 35% of under 3s. And I think that's an important part of this conversation to have as well when we're talking about participation or, ensuring sufficient supply. For what proportion of children are we talking about? Because it's very different, obviously, to schools where essentially there's a standard model and every child from basically 5 up is getting the same amount of hours in school publicly funded. So this is very different. There's much wider variations in families' preferences, in their arrangements, and what's obviously available and accessible to them. But I think that's just sometimes an important part of the picture that doesn't always get kind of the attention that it needs. Okay, so coming on then to the programme for government. So there's quite a substantial segment of the programme for government which focuses on early learning and childcare. These are kind of the headline pieces. I'm not going to go through all of it, don't worry. But the headline pieces, I think, are important for kind of grounding the discussion. So government is committing to continue to grow state involvement and investment in the sector while working in partnership with private providers, recognising this is an important element of supply. And to ensure that this change works for everyone, we'll undertake a broad consultation and publish a detailed action plan to build an affordable, high-quality, accessible early childhood education and care system with state-led facilities adding capacity. I'll come back to that. So the plan will enhance parental choice through ongoing support for public, private and community provision as well as childminders. So I think that does speak to the breadth of types of provision that are currently in the system or currently make up the sector. We'll come on to it more now in a second, but with the new introduction of state-led facilities. So that is very significant and a new departure. But it's very clear that we are talking about a range of different types of provision, including private, including community and childminders, as Eva had mentioned as well. There's a range of specific commitments, as I said, I'm not going to go into all of them, on affordability, educators, quality and inclusion, childminders, but I am going to talk about access because that's, I think, kind of where this comes into focus. So there's a kind of particular commitment about resourcing the department to deliver public supply, but I suppose that one that I've highlighted there, which is about providing capital investment to build or purchase state-owned childcare facilities to create additional capacity in areas where unmet need exists. So I think the focus on the state-led provision is very much situated within the policy problem that is seeking to address is supply and places. Now, capital investment is not the only answer, or indeed potentially the main answer to addressing supply, but it is part of the picture. But I think that's an important context to note, that the state-led element of the sector that's envisaged in the programme for government is about providing capital investment to build or purchase state-owned childcare facilities. So just that we know what we're dealing with here, that is what government has committed to, and therefore obviously we as department are focused on delivering. And I'll say a bit about how we're planning for that before kind of broadening out to the wider conversation about public model, right? So planning for state-led early learning and childcare, my unit has been involved in the development of a forward planning model. So that is really getting into the nuts and bolts of the detailed kind of nuanced analysis of supply and demand, and particularly the different types of supply and demand for different age groups of children and different types of provision, whether full day or sessional. We have negotiated over the summer, and there was an announcement of the National Development Plan in July, I think, of the allocation for this department. Sorry, not this department, the allocation for the department is much bigger. The allocation for early learning and childcare is 197 million over 5 years, and that's to be made up of investment in state-led early learning and childcare infrastructure, and note the focus on infrastructure buildings, investment in infrastructure of existing operators, so that's continuation of a building blocks type scheme, as well as wider quality initiatives. So the work that we've been doing in preparation for that is kind of the development of a pipeline of potential sites, the development of the approach to the operational side of that, and the establishment of a governance structure. And these are kind of some of the programme objectives that we're following on from the Programme for Government Commitments and the analysis that we've undertaken. These are the kind of key programme objectives, which is about, as I said, additional supply in suitable locations, additional supply for full day provision for children from 1 year old, with sufficient places to age up, ensuring cost effectiveness and timeliness of delivery, additional supply particularly in areas of disadvantage, in rural areas, quality and inclusion. And I suppose the last element of it, I think, is an important bridge maybe to the discussion, which is about supporting improved public management of the early learning and childcare sector. And that was envisaged to a certain extent in partnership with the public good, in their analysis, I suppose, and kind of detailed commentary within the body of the report talked about kind of the importance of this as part of the toolkit. So that was kind of has been envisaged, I suppose, from some years back. But I mean, I suppose the state-led early learning and childcare is one thing, but I just wanted to kind of then zoom back out again to a certain extent in terms of the public model more widely, right? So, and maybe we can pick up some of this in the context of the panel discussion, but the kind of terminology I think is important because I'm not convinced that there's kind of a shared understanding about that. We talk about a public system, a public model, public delivery, public management, state-led. Like they're not necessarily all the same things. Like, I would see us having, to a certain extent, and kind of that's what I was talking about at the start of the presentation, some elements of a public system or a public model in relation to funding, in relation to regulation, in relation to some of the public management tools that came along with core funding, the transparency, the fee control, etc. And then state-led delivery, which is what we're talking, the capital-led piece that we're embarking on, is kind of within that. It's an element of it, but they're not the same thing, I suppose. And maybe just that I would be interested in people's views, just of kind of teasing out the different understandings of those kind of terminologies. And in reflecting on this for me myself, I was kind of thinking, well, what does make it public, or what's the difference? In the public model. So I think kind of some of the key questions for us about where does the governance lie, where does the decision-making lie, and governance and decision-making in relation to things like places, service structure, fees, quality, value for money. And I suppose for us, this is very department kind of oriented question, but what exactly, when we're talking about public model and increased investment, what exactly are we talking about increased investment for, and where do the benefits accrue in that? So that's just some reflections that hopefully might help on the discussion.